Imagine waking up every day feeling like the worst moment of your life is happening all over again. That's the reality for about 8% of Canadian adults living with PTSD. Trapped in a loop of flashbacks, panic, and emotional shutdown, medications help some, therapy helps others, but for about 1/3 of patients, nothing seems to work. Now, a once taboo substance is showing promise in clinical trials, not just to numb the pain, but to actually rewire how and where trauma lives in the brain. MDMA, the active ingredient in the party drug ecstasy, is being repurposed as a powerful therapeutic tool. It sounds radical, maybe even risky, but it's already changing lives. Today, I'll break down the science, what an MDMA-assisted therapy session actually looks like, and whether it could be right for you. Let's get into it. PTSD is a debilitating mental health condition that develops after traumatic events like war zone combat, sexual assault, natural disasters, or serious accidents. Unlike typical stress, PTSD involves vivid, intrusive memories that force people to relive terrifying moments through flashbacks or nightmares. These can become so overwhelming that work, relationships, and overall quality of life begin to suffer. But why does this happen? How can PTSD hijack your brain and constantly replay your worst nightmares? The answer lies in how trauma reshapes three key brain regions: the amygdala, the hippocampus, and the prefrontal cortex. The amygdala is like the brain's threat detector. In PTSD, it becomes hyperactive, like a smoke alarm set too sensitive. It goes off at the slightest sign of trouble, whether danger is real or not. This often triggers a fight or flight response, even in safe environments. The hippocampus, which organizes memories, often shrinks and malfunctions after trauma. Think of it like a disorganized assistant who keeps misfiling events or marking them the wrong dates. This causes traumatic memories to feel like they're happening now, not in the past. Finally, the prefrontal cortex, responsible for reasoning and emotional regulation, becomes less active. It struggles to suppress the amygdala's false alarms or bring order to the hippocampus's confusion, making it hard to recalibrate fear. Together, these changes create a perfect storm. The brain sounds constant alarms, loses track of time, and lacks the control to intervene. That's why PTSD feels like being trapped in a loop, not just remembering trauma, but reliving it. In Canada, PTSD is typically treated with medication and therapy, usually SSRIs and trauma-focused approaches like cognitive processing therapy or EMDR. Yet about 1 in 3 patients don't find lasting relief. In response, MDMA-assisted therapy is gaining momentum in Canada for its potential to offer faster, longer-lasting relief from chronic PTSD. To understand why, we first need to look at how MDMA works in the brain and why its effects are so promising. Functional MRI studies show that MDMA kind of undoes the effects of PTSD by acting on all 3 brain regions the disorder affects. Firstly, it quiets the overactive amygdala, dampening the fear response. Secondly, it boosts the underactive prefrontal cortex, helping to better regulate emotions and see things in a more rational light. This helps patients engage with painful memories without being hijacked by panic or dissociation. And lastly, and most interestingly, it has powerful effects on the hippocampus. When we recall a memory, particularly an emotional one, it becomes briefly malleable, like soft clay. It can be edited or updated before being restored in the brain, a process known as memory reconsolidation. Now remember that in PTSD, we have our disorganized assistant running our memory filing system. Once they bring a memory out of storage, they can't find the right place to put it back. So traumatic memory keeps getting reconsolidated incorrectly, leading to repeated experiences, reliving it again and again. This is where MDMA does something remarkable. It increases levels of a protein called brain-derived neurotrophic factor, or BDNF, especially in the parts of the brain associated with memory reconsolidation. Why is this a big deal? Well, BDNF is like fertilizer for your brain. It helps recreate and strengthen new neural connections and supports longer-term changes in how your brain is wired. Higher levels of BDNF in the hippocampus enhances this plasticity, enabling the brain to restore traumatic memories in a less distressing form. In PTSD, this can correct dysfunctional memory processing, allowing old fear-laden memories to be recontextualized more accurately and safely. The combination of increased BDNF and the reduced fear response from the dampened amygdala creates the ideal conditions for safely revisiting traumatic memories. Patients can engage with these memories, update their emotional associations, and overwrite the original traumatic encoding with new, less distressing meaning. In other words, we get a new organized assistant in our mental health filing cabinet. And as if that weren't enough, MDMA also taps into another process that's immensely helpful to PTSD patients. When it enters the brain, it triggers an immediate and substantial release of several brain chemicals and hormones, mainly serotonin, dopamine, oxytocin, and adrenaline. This flood of feel-good chemicals creates an intense state of emotional openness. So intense, you might even call it ecstasy. And what better headspace to be in when you confront your demons, right? In all seriousness, this mental state greatly facilitates something called fear extinction, the process of learning that previously threatening stimuli no longer signal danger. Research at Johns Hopkins demonstrated that MDMA reopens what neuroscientists call a critical period for social reward learning, similar to developmental windows when the brain is especially plastic in the earlier years. And unlike traditional meds, you don't need to take MDMA daily to get these benefits. In fact, just a few sessions could be all that you need to get on the road to lasting recovery. Let me explain. MDMA temporarily increases serotonin levels, which can enhance mood and emotional openness. However, the brain needs time to replenish serotonin after each use. That's why MDMA-assisted therapy is designed to be limited. Most clinical trial participants receive a total of 1 to 3 8-hour MDMA sessions with added integration sessions, all spread out over several weeks to prevent neurochemical imbalances. And before you ask, yes, MDMA-assisted therapy is entirely legal in Canada through Health Canada's Special Access Program or clinical trials. However, since MDMA is classified as a Schedule III controlled substance, it is illegal to use outside of these authorized contexts. In addition to seeking legal avenues for treatment, MDMA-assisted therapy also requires the therapist or physician to be present throughout the entire experience to provide continuous support. The actual sessions themselves are designed to be as comfortable and non-intimidating as possible, typically a private room with comfortable furniture, soft lighting, and soothing music. Once settled, the patient will ingest a carefully controlled dose of MDMA ranging from 75 to 180 milligrams, sometimes followed by an optional 40 milligram booster dose about 2 hours later to extend the therapeutic window. Unlike recreational use where users might feel euphoric, patients in therapeutic settings don't typically feel blissed out. The process involves confronting difficult emotions and traumatic memories, which is why having licensed therapists in the room to support and ensure safety in the experience is so important. The effects typically last up to 8 hours and are followed by integration sessions where you'll talk with your therapist about everything you've experienced and integrate it into your daily life. While it can sound magical, MDMA is far from a miracle cure. It's a medication, and like any medication, it comes with risks and limitations. The most common side effects include increased heart rate and blood pressure during the session, potentially posing risks for patients with cardiovascular conditions. The drug can also cause temporary issues with body heat regulation and insomnia. While serious adverse events in clinical trials have been rare, careful medical screening is essential before starting any treatment. Some patients also report temporary increases in anxiety, fatigue, or low mood in the days following treatment. There have also been concerns about potentially worsening symptoms in certain individuals, though clinical trials have generally shown good tolerability. The potential payoff of MDMA-assisted therapy for PTSD is profound, nothing less than a paradigm shift in how we treat trauma. Clinical trials have consistently shown remarkable results. One clinical trial showed that 71% of participants no longer met diagnostic criteria for PTSD by the end of an 18-week course of MDMA-assisted therapy. Another study found that 67% of people reported no longer meeting criteria for PTSD, a full year after completing treatment. For patients who have exhausted conventional PTSD treatments, MDMA-assisted therapy could be worth exploring. It creates space for healing, and with the right support can offer a real turning point towards a better life. At Field Trip Health, every step of your care is guided by experienced medical professionals. Through our clinical trials in 2025 and beyond, clients will be able to access MDMA therapies in a group setting without needing a diagnosis or going through Health Canada's Special Access Program.
Integrated with psychedelic medicine. I think it's going to have tremendous impacts on the Canadian mental health landscape as we're providing rapid mental health treatments compared to other therapies such as antidepressants and therapy alone. The use of psychedelic medicine is a new and up-and-coming field of medicine that is going to provide people with support that they're not getting from their current therapies potentially.
Ketamine is the poster child for a paradigm shift in how we think about treating depression. People were amazed to see that in 24 hours to 2 days had an immediate effect.
And what we're hoping to do is to open the mind, to go deeper, faster, and quicker, to alleviate substantial suffering such as severe depression very quickly.
If you or someone you know is interested, I put a link in the description to learn more. If you're ready to take the next step, we offer a free discovery call to see if MDMA therapy is right for you. We'd be happy to hear from you. Thanks for watching, and see you on the next one.